You've heard it for a while now. Medicare open enrollment is in full swing, but it can be a confusing time for seniors 65 and older to understand fully their medical coverage choices. Here with what you need to know is Dr. Tracy Wakefield, Medical Director of Healthcare Partners Medical Group. Good morning to you. Welcome back.
Oh, good morning to you too.
It's great to see you. Now, Medicare open enrollment is underway and it runs through December 7th. It's a big time for seniors. But for people who don't know, what exactly is open enrollment?
Open enrollment is the time that occurs once a year where seniors over age 65 can make changes to their health care benefits.
And what kind of changes are we talking about here?
Oh, they can change anything from the cost of prescriptions that they're going to have in the future, as well as even their providers.
So it's not guaranteed that it is the same as last year, and that's why it's so important to go over your coverage.
Correct. It's really important to review your benefits and coverage at this time of the year, because whatever choices you make now are going to affect you for the entire next year.
So you're saying you are locked in for 1 year after you sign up?
Yes, generally so.
Okay, and tell us about Medicare and how it differs from Medicare Advantage. What exactly is that?
So Medicare Advantage is when a private company takes over some of the administrative processes of your Medicare. So they still have the same coverage as Medicare, but a private company is, like I said, taking over the administration of those services.
And can you lose some of those services, though, if you go and are under, let's say, Medicare Plan A or B?
You don't lose any of your services.
Okay.
Medicare Advantage plans have to cover the same thing that Medicare does. The only thing Medicare Advantage doesn't cover is hospice, but you retain that benefit under your Medicare.
So it covers basically all the services that you've had before?
Absolutely. It has to. The plans have to.
And there are advantages of doing that plan for seniors?
Absolutely. The nice thing about Medicare Advantage plans is they offer you a lot more options and a lot more coordination of the care that you're receiving, which is particularly important, you know, in that age of people over the age of 65.
So if you don't have it now and you would like to have it, this is the time to sign up for it?
Correct. And you have until December 7th to do so.
And when did this open enrollment begin?
It began October 15th and it'll end December 7th.
And can we talk about some of the costs then? Do you know anything about that?
Well, there's no added cost when you join a Medicare Advantage plan. And actually, there can be quite a bit of cost savings in the sense of you're not, you know, the 80-20 that you get under Medicare, and also a lot of your prescriptions will be cheaper and your co-pays may be cheaper as well. So for a lot of patients, it's actually cost saving to have a Medicare Advantage plan.
Now, Healthcare Partners is known for its total care model. Can you explain to us what that means and how that impacts seniors?
So our total care model offers seniors basically a team of primary care providers, specialists, and professional staff that are meant to help them, you know, attain all the goals they have to keep and maintain their health.
It's almost like you're getting concierge service without having to pay the higher premium.
Right. It's very much like the VIP services that you'll see some medical groups offer, but with no added cost to the patients.
And when it comes to that, you are automatically enrolled if you become a member. Is that right?
Correct. You're automatically enrolled to our total care model if you join a plan that we cover. Absolutely.
So if a patient, let's say, comes in, needs services, but didn't know that they needed even more things done, you would take care of all that and refer them out so that they can get help.
Absolutely, into our specialist network, and we're going to guide them and kind of navigate with them through that area.
Yeah, and as we mentioned earlier, this can be a really confusing time for seniors, but you're making it easy for them because you have open houses that people can learn more.
Correct. We have about 10 open houses left in the next couple of weeks that you can RSVP at our website. And you can go there and get any of your questions answered and concerns about really kind of the services that we offer and the services that you can expect.
Do you charge for these open houses?
Oh, absolutely no.
So it's a free service. And how long does it usually one take if you're sitting in on one?
Oh, probably about a good hour at least, or maybe even a couple hours, depending on the length. And I'm sure there'll be a lot of question and answer sessions and things like that. You know, we'd like to address all the issues.
Can seniors bring their loved ones to help them make a decision?
Oh, absolutely, and I'd encourage that because I think, you know, a lot of these decisions should be made with other people that are important to you that, you know, can help you in that decision making.
And when it comes to open enrollment, again, it's so critical for you to look through your plan because this is the one time you have to make a change.
Absolutely. You've got to think about, you know, in the last year, did I have trouble meeting the cost of my medications? Did I have trouble with co-pays? And you may want to know that going into choosing a new plan for next year because you may want to get those gaps covered.
And that's so important to go through that, and those open houses really help too. So you'll have professionals there
Absolutely, who
people.
can answer all their questions and concerns and really understand the coverage that they're signing up for.
And again, there are so many different levels in the plan, and Medicare Advantage plan is one of those that you can sign up for.
Right, and the Medicare Advantage, like I said, offers a lot of incentive in the fact that patients don't have to, carry a lot of the cost for prescription drugs and for co-pays. And actually, remember, straight Medicare is an 80-20 plan, and that 20% can add up significantly over the year.
All right, some great information for us. Thank you so much. Thank you. Now, we can go to the website or right there on your screen for more information on healthcare partners. They're also on Facebook and Twitter. Medicare Open Enrollment, again, ends on December 7th.